This is a patient with double arthrodesis. This is the incision on the medial side. But also there was a posterotibial tendon repair too, hence the incision going a little bit higher. We're going to take a look at this side. She's about 4 months out of surgery right now. Let's bring your knee up. Do me a favor, move that ankle up and around in a circle. Up and around. Any limitation or ankle range of motion?
No.
How much pain do you have?
Very little.
How much pain did you have before surgery?
Oh, excruciating.
You were begging for the surgery. You had a big
Yes.
lump and a bump here too that we took down. So
Brought tears to my eyes.
Are you happy with the results so far?
Oh, yes.
Yeah. Any advice for people who are thinking about this surgery, thinking that we're going to limit too much range of motion?
Don't wait too long.
That is correct. Look, that range of motion is perfect. That range of motion is coming from the ankle, not from the talonavicular or the subtalar joint. Now, as you can see, this is done via the one-sided approach versus the double approach, which is typically done. The purpose behind a single approach versus double approach is the single approach allows us to access both joints through one incision, less healing time and less complications, as well as better exposure for the surgeon who's familiar with doing that double incision. Single incision versus double incision. Double incision will entail the same incision on this side, but also an incision on this side too, which you see there's no incision over here, and the swelling is wonderful. So we took out one possibility of complication from this surgery by making only one incision for this procedure. Patient's been walking a cam boot with zero pain at this moment. As you can see, the swelling is awesome. She does not have any. Let's take a look at the x-rays. This is that same patient that we looked at before for double arthrodesis. She's 80 years old. This is 4 months out. This is the double arthrodesis, able to access this double arthrodesis site through one incision. This is the fusion. Notice the osseous healing. This is the same exact patient from the AP and oblique view. Notice the washer for the screw in order to obtain the proper purchase of that screw, secondary to her being 80 years old and having non-proper weight bearing on the talonavicular joint for some time. So we did have some difficulty in having proper screw purchased, but the washer helped hold the arthrodesis in position, and as you can see, arthrodesis has progressed exceedingly well with the talonavicular joint completely fused. Calcaneal cuboid joint is in proper alignment. This is complete weight-bearing views. 48-year-old female with a history of tarsal tunnel syndrome, as well as collapse of the foot. It was a severe collapsed foot. Could not tolerate a AFO, although you did wear AFO for about a couple years, right?
Right, 2.5. 2.5
years. So here she is. We did a tarsal tunnel release. She was having nerve symptoms down the medial ankle. This is the incision. The incision for a double arthrodesis usually goes from here to here. I had to extend it more proximally on this end, just so we can go ahead and release that tarsal tunnel as well as repair the posterotibial tendon. Again, this is all the scar. There's no scar on the lateral aspect. This is a single incision double arthrodesis. We are at about 4 months post-op on this patient right here, and she has no pain.
Nope.
She's been walking around, no tingling or burning sensation like that before surgery. Am I correct?
Yeah.
Can you move your ankle up and down? A lot of people are afraid of being stuck, but you're really not stuck when we do a double arthrodesis.
I have been doing my own little bit of therapy at home to help get through the day.
No, it looks good. Your bone have been looking good. Any tips for people who are anticipating surgery or are scared of the surgery?
They shouldn't really be scared of the surgery, and they should talk to the doctor or a little extra effort about it to make sure they know everything before surgery so they don't get too scared.
Okay.
And the doctor will work a little extra time to make sure if you have any doubts or fears.
And obviously experience of the doctor doing the surgery too.
Right. Makes
a huge difference in the outcome.
And sometimes a second opinion is better than a first opinion.
Was that your second opinion?
Yeah, because the first guy was worse.
What did the first guy tell you?
Dr. Goodman, he said I just had fasciitis pain, take a mild muscle relaxant and go to yoga.
Yeah, well, yoga would not help that. Your
No,
foot, your
and I
foot was
told her there was
collapsing.
something more going on than that.
Your foot was your ankle and foot was in a progressive collapse.
Yeah,
or that.
he just billed the insurance company and didn't really want to deal with it, so I got a better doctor.
Well, we can't help with that, but we did fix your problem.
Yeah,
I'm very
she
happy
did.
you've done well. I'm gonna get you an ankle brace today and get you out of that boot today. How's that
All
sound?
right, that's good. Yes, and I'm healing about 3 weeks sooner than I expected.
I think you are. You've actually surprised me with your healing.
Yeah.
You've done very well.
Yeah,
So
I did everything you told me to do, right down to the T.
Great. Well, you've been an excellent patient, my friend.
Uh-huh.
I'll show you X-rays and
A
talk
little
about that.
impatient at times with the cast, but I was fine.
Overall, the outcome is great.
Yep, and I want somebody.
This is the same patient. This is double arthrodesis again. This is a single screw to talonavicular joint. Also, there was a posterior tibial tendon repair. There was a tibialis externum on the side, extra piece of bone. This is 2 screws again fixating the subtalar joint, as you can see. She has progressed faster than I expected, and she has some good fusion right across those sites.